Executive Director at Consumers Research, is joining us again. His name is Hild, and nonprofit hospitals probably not using the money correctly. Good morning, Will.
Good morning. Great to be with you.
Yeah, do you eat avocados? I love avocados.
I do love a good avocado, and I share your frustration with trying to get stuff like that to grow. I got into trying to grow berries for a while, a few years back, and it's surprisingly hard to get those. They have to overwinter, or you have to scar them, and it never works.
Yeah, I'm trying so hard. I've got corn cob spikes in the sides of a peeled pit that I took the brown off of the pit, and it's been soaking in water for 3 weeks, and I have no sprouts. So I think I'm going to wrap it in a paper towel, put it in a baggie, and hide it in a dark closet and see what happens. But just pray I don't forget it's there, and it scares me in a couple of years. All right, so let's talk about your warning for everyone about woke hospitals who are embracing political parties ahead of patient care. What do you mean by that? Are there hospitals that are woke or unwoke?
Yeah, that's exactly right. We started to look into the healthcare industry. We were tipped off by a number of people whistleblowing about what they were seeing going on in some of the most famous healthcare systems in America, places like Cleveland Clinic, Vanderbilt, Henry Ford Health. And the more we looked into it, the more we realized that a lot of these healthcare systems that you would think, because of their 501c3 nonprofit status, because of the fact that they get tons of federal and state subsidies directly in the form of grants, that they would be sort of middle of the road or straight down the line. They'd be focused on medical research only and patient care only. And we found it could not be further from the truth. These organizations have become completely colonized by what Elon Musk called the woke mind virus. What I mean by that is basically a trifecta of wokeness. The first is spending tons of money on these green boondoggles, these net zero projects that have nothing to do with patient care. They have nothing to do with medicine at all. Cleveland Clinic, I think, spent $7 million on one of these, for example. The second is engaging in DEI, racial and sexual-based discrimination, not only with their staff and their hiring and promotion internally, but when it comes to these health systems, some of them were engaging in discrimination based on patient care, prioritizing some types of patients over others. And then last but certainly not least, the worst of the worst, these health systems engaging in the transing of children or the gender-affirming care. That's what the left calls it. I call it the sexual mutilation of minors, sex change operations and procedures for kids. And so we saw that in a number of these organizations, and these are places that are basically exist because we subsidize them both through the tax code and directly through federal and state grants. So we're raising the alarm to say they need to get back to patient care, they need to get back to medicine, and not on going into woke activism.
Yeah, and get out of climate activism too. They need to do what they're supposed to do. Now, it is weird to me because this didn't just start last week. So they've been doing this for a long time. And I know the woke ideology basically got called out about maybe 10 years ago, but they probably started long before then.
Yeah, this is something that has been building over a long period. We saw that in corporate America. I mean, really, the proto-DEI department was the Human Resources Department. When they went from personnel and benefits, they were the people that made sure that you got your health care and that you got your 401k was set up correctly, to micromanaging your views and opinions and the politics within inside of the corporate America. And that was sort of the first step towards a DEI department that expressly is discriminatory against whites and often Asians and sometimes Jews, now that they've encompassed this whole Palestinian issue into a lot of their politics. So yeah, this has been building over time, but we've really reached a fever pitch. And in some ways, the corporate America has been quicker to backtrack from some of this than the healthcare systems are. And a big part of that is they're insulated because of their 501c3 charitable tax status, because they get these federal and state subsidies. And so that's why we're raising the alarm. We hope that with the incoming Trump administration and their focus at the Department of Justice, with people like Harmeet Dillon running the Department of Civil Rights, that they will look at this stuff seriously and really consider, whether these organizations really deserve their tax status. I mean, I can tell you this: if I got caught discriminating, we're a nonprofit, we're a 501c3. If we got caught discriminating against people based on their race or their sex, we would have our C3 status pulled overnight. So the question is, why are these groups that got their C3 status based on providing patient care and medical research, if they're not doing that? And to be clear, the Cleveland Clinic CEO was quoted saying, healthcare is only part of our mission. Well, if that's only part of your mission, then what is your other mission? And was that 501c3 status? Should you have a charitable status for that stuff? You should be focusing on why we gave you the tax subsidy and why we give you the grants, not engaging in this woke politics.
Well, there was a resounding, we don't want to pay for this crap in a vote just not long ago, saying we want to get back to basics. We want, hospitals to do what they're supposed to do, clinics to do what they're supposed to do. We don't want all this ideology stuff to affect anywhere. So the fact that many of us don't want our tax dollars given to places like this, we get called all kinds of names, that we hate these people or hate those people. No, we're just fine, but pay for it yourself. I don't want to pay for it.
Yeah, 100%. I completely agree. But we really got to shake off any fear we have of being called racist. These people are engaging in rank anti-white and anti-Asian discrimination. If anyone's racist, there's no question who it is. It's these DEI people. Yeah. So these hospitals, the Cleveland Clinic had a program called the Minority Stroke Program and the Minority Men's Health Program. They put on the label of the program that it was supposed to be focused on people of a specific race. So, or at least non-whites, maybe blacks and Hispanics and others, but not white people. And that is disgusting. It's high time we call it out, and our tax dollars shouldn't be subsidizing, either explicitly or implicitly.
Well, I love how they think there are no poor white people. There was a comedian on AGT from Africa. When he came over, he goes, the thing that surprised me the most about America, I thought he was going to say cheeseburgers or just, the shopping markets or whatever. He said, you have poor white people. And, everybody laughed, but that is a really stupid stereotype that all white people are born with money. And that's not the case. So they should never be put on a list that excludes them from getting help because it's for a minority. It should be an income-based.
That's exactly right. And we saw that in higher ed admissions as well. One of the things that was happening in some of these Ivy Leagues is that if you were white and you were, say, the daughter of Andrew Cuomo or somebody like that, then you could either find a way to get into one of these categories, like she came out as pansexual, which is like a ridiculous made-up term, or you could, fiddle around, you could find a way to get in. But if you were a very intelligent, hardworking kid from Appalachia, but you were white, good luck. It ain't happening, right?
So pansexual mean she likes to cook? What does that mean? I don't even know what pansexual means.
I think it means she's sexually attracted to potentially anyone, which is, okay, what does that have to do with, whether you should, be admitted to Harvard, right? It's a way around, it's a way for the children of the elite to game the system so that their children we can seem to have a system that's trying to help out the underprivileged or the discriminated against or whatever, which is what DEI purports to be. But what it really is a system for people to game. Okay, it's just like I believe Claudine Gay, the former black president of Harvard before she was kicked out. I think her parents are like concrete magnates in Haiti, for example. So she's using the DEI idea of, we've got underprivileged people who haven't had a chance because of their ethnic makeup. But when you look at who's actually getting those slots, it's children of elites, both domestically and internationally. So what this is, it's not DEI is not an opportunity, not a program that opens up organizations to people who didn't have access before. It is a program of castling up these organizations, making them more elite, making them more ivory tower.
That's just ridiculous. These are hospitals. When I was a kid, if you were pansexual, we just called you a horn dog. That's what we called you. So I don't understand this whole labeling and making up terms. I'll sit in a meeting and someone will say the term. I'm like, 90% of us don't even know what that means. So just keep your sexuality to yourself. None of us care what you do in your bedroom. Are you qualified or are you not qualified? Are you someone who needs help or are you not someone who needs help? Those should be the categories, not this, what kind of position do you like sexually? I mean, come on, man. Who cares about that?
I completely agree, and you raise a good point there, which is no matter who you are, even if you're one of the groups that is supposedly being discriminated on behalf of with DEI, when you elevate people in anything, whether it's, a hospital system like what we're talking about today, or in an airline with pilots, or in the military, when you put people in jobs who don't actually, or aren't the most skilled, aren't the most competent, but you've chosen people based on race or sex, you're endangering the lives of everyone involved. right? Who wants a airline pilot chosen because of the color of their skin? Who wants a surgeon chosen because of the genitalia between their legs? Nobody does. Nobody. It shouldn't matter.
And
so that's why it's so important we get down on this.
Yeah, well, these millions of dollars could be much better spent elsewhere.
That's exactly right, and it shades their research. When you start, DEI is a megalomaniac ideology. It believes it should be in charge of everything. These DEI departments, if you go look at the people who are in charge of them, their own quotes, they will say DEI is being integrated into everything we do. Well, that means that when we give millions upon millions of dollars to the Vanderbilt Health System or Cleveland Clinic or Henry Ford Health, DEI, if their DEI department is true to its word, it's taking over those research dollars and affecting how they're spent, what they're spent on, how the research is conducted. We don't want that. We want the answers. We want the truth. That's why we give money to these institutions, because that's going to lead to the treatments that are going to save lives. But if we have DEI, if the person chosen to do the research is chosen because of the color of their skin, if certain lines of research are found to be unpalatable to the DEI department, we are wasting our money. And so that's why we're raising the alarm on this.
Well, the John Hopkins one really surprised me. The Herman Medical also surprised me, and Memorial Herman. Some of these you would never dream that they would do this sort of thing, but they are, and they're all in your report with 1 minute left. Where do people go to read that report?
Absolutely. They can visit us at consumersresearch.org. That's consumersresearch.org. They can follow me on Twitter at @WillHild. That's WILLHILD.
Everybody, check it out. You're going to be shocked at what they're spending the money on and how much money they're getting as 501c3s. If these are nonprofit hospitals, they could be taking that DEI money and maybe curing a child of cancer, or somebody having a mastectomy, or something that is life-changing other than just trying to get the right number of the rainbow in their offices. It's offensive to me that we are divided by our sexuality in this country, and it needs to stop. It's gross. Will, thank you.
Thank you so much for having me on.
You're welcome. Bye-bye.